Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, welcome to the Pharmacy Leaders Podcast. Today's episode is for the weekend, of course, but Labor Day weekend, and happy Labor Day weekend. But it's really in response to YFP's recent one with Tim Church, who talked a bit about reasons that you would need a little bit of extra side income, especially with what's been going on with 32 hours, with maybe some difficulty finding full-time work or work that you want to do, and kind of some choices that you could have in terms of finding extra income without overburdening yourself. Tim Church mentioned that he kind of burnt out after a while, and doing that extra work is just extra working, but then found some sources of passive income, and that's kind of ultimately the goal, is to go from that active, having to work for it, to getting the passive income coming in every month. So, for example, with me, one of my rental homes flooded, and that was about $4,500, and instead of that cutting into my personal bank account, it just unfortunately took a little bit away from next month's income, from the books, from the other things that I do. But again, I keep kind of a massive store chest to make sure that I'm safe, my family's safe financially. So let's go through the same kind of people we go through every week, but what I'm going to do is I'm going to put it in the framework of The Go-Giver, which is a book that Tim Church mentioned. And The Go-Giver basically puts it the way that I heard it from Brian Buffini, who is the kind of real estate guy, is give, ask, receive. That is, you give, then you ask for something, then maybe you receive it, but not really in a, well, I hooked you up, now it's time to hook me up way. And then the Go-Giver book talks about that as well. But really in the terms of, when you're thinking about doing something outside of, just working for money, time for money, you really want to do is find a way that you serve in a way that's unique, but also that's something that you enjoy. I don't know that as many people would enjoy the etymology of drug names like I do, so that's very unique to me. I don't know if people would enjoy editing work for the ear or for audiobooks, but that's something I really enjoy. And some of the things that these other leaders do, they enjoy, but I probably wouldn't enjoy. So let's start with TLDR Pharmacy, though I'd probably enjoy what he does. He really takes something that's very complex and makes it really fun to read. He puts them in blog posts, but then he also creates great cheat sheets like those for diabetes, for hypercholesterolemia, MPJE, multi-state pharmacy jurisprudence exam. And he's really doing this because he had trouble with it, and he wants other people to have less trouble with it. And as pharmacists, we've always kind of struggled with this. Well, if I do something and take money, then in some way that I'm evil or something like that. And the Go-Giver also addresses this, where it's okay to be wealthy and it's okay to be altruistic. These are not an either or, and actually they go together. I found that at the highest level, those that are the highest earners, making hundreds of thousands to millions of dollars a year, are actually the most giving. And you say, well, they got plenty of money, that's why they give. It's actually the other way around. They have plenty of money because they did give. And again, it's that give, ask, receive. And the more that you are able to give, and the Go-Giver goes through a step-by-step process for this, a book I definitely recommend, that's what you really want to do. And I'll talk about YFP's episode in a minute, but if you look at TLDR's Pharmacy's model, he just asks for a couple bucks, especially for subscribers. We always get the offers a bit early, get them for a lot cheaper, and then you've been able to get some of my audiobooks for free from TLDR as well. So there's always value there. He's always thinking about other people, and I definitely think that'd be great to support him at tldrpharmacy.com, especially if you're someone who's in clinical practice, somebody who really wants to kind of keep up on the newest things. The Happy Farm D, Alex Barker wrote this week's post, and then Jackie Boyle wrote last week, so she had written a letter to herself. And then, so there's two stories here. The first one is the pharmacy manager proves you can manage side projects while working full-time. And I don't know if I'm messing this name up, but Carlos Irula, who's a pharmacy manager with Kroger in Frisco, Texas, graduated from the University of Louisiana Monroe, and he has a side business called Care Commute. I'm not going to go into it, but definitely recommend you check out the Happy Farm D's blog post and see how can you turn these side projects into something that might be a side income. And ultimately, it's really, are you providing value to other people? And if you are, then great. And then how do you make money out of it? Then it's really how many people are you providing value to? So I'm just about to hit 15,000 with the number of audiobooks that I've helped other people with. So those parents and other people that are just really busy and don't have time to study pharmacology and then maybe pharmacotherapy like the new book, well, here's an audiobook. You can get it free on Audible if you've never had one before. But even if you don't, if you think against the $160,000 you're in debt at the end of pharmacy school, the $15 that it cost doesn't really seem like a ton of money. So I tried to provide a ton of value for a very low price. Relative to the textbooks and things like that, it's only a fraction of that. So, but in terms of Alex Barker's blog post, I would definitely take a minute to read the pharmacy manager who's managed to get that side gig. Alex Barker just left his job at the VA to work on was his side hustle full time, and he's talked about it all the way through. These were my failures, these are my successes, and there were a lot of ups and downs, and pharmacy was the way for him to keep himself financially in good stead while he was trying different things out. Sometimes he spent too much time away from the family, but now I think he's going to be the other way where he's going to be able to spend lots of time with the family. So I know I'm excited for him, I'm excited for all the work he did, and I think it really came from a place of altruism where he was really trying to make people better and continues to by coaching them on ways that they can either make their job better or transition into a different career that maybe provides them a bit more satisfaction. Okay? Another entrepreneur, Eric Christensen. So I'll talk about the book in a minute, but he's done Med Ed 101 for a long time. There just aren't a lot of places to get BCPS content because there just aren't a lot of pharmacists. And when I say there aren't a lot, there are 3.1 million nurses and there are 300,000 pharmacists. And of those pharmacists, every year, only 25% go on to do residency who are graduating. And then of those, the ones who actually seek certification, that's an even smaller number. So it's very small population, but he was very interested in helping them. He lists his struggles with certain things, but also he does a great job of providing quick cases to help you really understand what's going on. He also provides a free podcast, Real Life Pharmacology. Each week he goes over a new, whether it's a drug or a drug classification, 7 to 15 minutes, and he doesn't get anything for that. Maybe he gets a little bit of contact to his products. The same with me. I put out a couple $1,000s a year to put out my podcast, and there's no, I don't have advertising on it on purpose, so that if I'm recommending somebody, then I know that it's something that I can truly recommend, and there's no compensation for it. So the other part of Eric Christensen or Med Ed 101's line is the new thrill of the case. So it's still 99 cents on Kindle. I'm not sure how long that's going to last, but I definitely recommend you check it out. They're really quick hitters. It's here's a case, here's you learn something, and it's just like, well, man, why would I read a whole big pharmacotherapy book? And that's not what I'm asking you to do. I'm just saying, hey, here's a book for 99 cents that's going to provide you a lot of value, and the case is going to come case after case after case, and it just takes reading maybe one or two a day to just get much, much better and a much wider understanding of being a good clinician. Really, being a good clinician is about experience and just hearing more cases, learning more. My Memorizing Pharmacology book, again, thank you for those of you that have bought it. Memorizing Pharmacology Mnemonics if you want something a bit more advanced. But if you're looking to memorize around 450 drugs, Memorizing Pharmacology Mnemonics that new one is definitely something that can help you. Well, let's go on to the podcast. Todd Urey, who has been giving and giving for almost 10 years now, he started the Pharmacy Podcast Network in 2009. He's not a pharmacist. He's a technology guy that started with pharmacy, worked with pharmacy, and he has continued to put other people ahead of himself. He's mentored me as I was learning the podcasting and mentored me through 50 or 60 episodes, and he's mentoring students down at Nova Southeastern on how to podcast and show themselves to the world, but also meeting other people. And then he provides tremendous value for other businesses within pharmacy. So on Monday, I think it was the Integra Group, Integra LTC Solutions. It was the third part of the podcast series with Chad Wars, the CEO of ASCP. And then it was just the next day, First Financial Bank was delivering a 3-part series about the importance of financial resources in your independent pharmacy business. And then it wasn't just if, but when. Dr. Scott Jelson from Nova Southeastern interviewed Earl Buddy Carter, Republican from Georgia, about the opioid epidemic, PBM reform, drug prices, and community pharmacies' leadership towards provider status. And it's on the Politalk RX, the new, probably the newest podcast in the Pharmacy Podcast Network. And it just came out today, so I definitely recommend that you listen to it, especially with this great Labor Day weekend coming up. And that's episode 675, Earl Buddy Carter on Politalk RX. Our own Anthony Pudlow, who is the Vice President of Professional Affairs at the Iowa Pharmacy Association, talks about the expanding role of pharmacy technicians in Iowa to Pharmacy Times. That was in my inbox, but it's always kind of neat to see how, if you're looking at some of the more progressive states, Iowa is definitely one of them, and it's just a matter of time that technicians are going to take over many of the roles that pharmacists have, and we're just making sure that the pharmacists are able to do those things that are going to continue to keep them in the pharmacy doing the things that are going to help the patient. So definitely check that out. It's on Pharmacy Times. It's just a minute long, but it was filmed at the National Association of Chain Drug Stores Total Drug Expo 2018. And I think that you'll get a lot out of that too. In my email box also from Tom Menahan, the CEO of APHA, is a little bit more about advocacy and action and how APHA members lead the way. Talks about Congressman Mia Love's legislative team member who got a firsthand look at pharmacist services. And really it's continuing to let legislators know about what we do. I didn't realize it takes about 8 years to get something through. I thought, oh, well, it'll just be next year or it'll be next year. But really it comes down to, when is that 8 years up? I don't know if it's exactly like that, but I do know that we have to continue to let our legislators know that we do provide this value, because the number of pharmacists that are out there could really benefit, one, from having that provider status, but also we're competing with new schools continuing to crank out nurse practitioners, physician assistants, and we're seeing medical-only campuses, which are just graduate schools that are just building on the need for health professionals. So it's not just that congressmen don't get it, it's that congressmen are listening to us say, okay, well, we see what you do. And then maybe nurse practitioners and physician assistants come in and say, okay, well, we can do that, but we can also prescribe. And I think that we just have to keep at it, because what we do is unique. If you read or listen to the Pharmacotherapy book that Eric Christensen has, in there, he really asked that question and took a long look at it. Said, well, nurses look at what we do, or do some of the things that we do. PAs do some of the things that we do in terms of checking meds and things like that. And what is the difference? And our lens is really, really the difference. Okay. So Your Financial Pharmacist, again, I recommend checking out Tim Church, latest from YFP, and the Intro to the Side Hustle series. You'll learn a lot about getting side jobs. And then RX Radio didn't have anything new. Should you change careers was the most recent one. How to quit pharmacy and change your career from Kevin Yee. And then Paul Tran had his DIY project. He hasn't done anything really recently. And then also Brian Fung as well. So recommend you continue to check out their YouTube channels. And I think you'll really enjoy the content that they have. So have a happy weekend. Looks like my kids are home. So I will talk to you guys soon.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.